Good morning, everybody. Happy after Valentine's Day. Wait, day after Valentine's Day. Um, so I hope that you had a great Valentine's Day yesterday. It was my 13th wedding anniversary, so I had a really good day. Um, I'm glad that you've joined us this morning in our quarterly System of Care statewide community meeting. We are expecting more people to continue to join, so hopefully we'll have a good audience within a few minutes. We have a really good program for you today. We're going to be focusing on the topic of the opioid and fentanyl crisis, not just in Texas, but in the really globally. But we're going to be talking specifically about Texas efforts to combat this crisis and what resources are available to each of you. So I hope that you're ready to take some notes and get a bunch of resources to help you in your work. Before I introduce our speakers this morning, I wanted to just let you know that we'll be putting in the chat closer to the end of the session the sign-in link. And we do need every single person to use the link, sign in, and let us know that you've attended today's meeting, and then just evaluate how well you benefited from the training session. So that'll be towards the end of the meeting. Please take a minute to do that. I know some of you don't really need the CEU certificate or want that, but that doesn't matter. We still need to know that you've joined us, and the evaluation will only take you a couple of minutes to complete. So please do that. And then also, I wanted to encourage you guys that for these quarterly sessions to always share the invite with any of your colleagues in the field, whether they're providing services, mental health services, or educational services, or anything else, as long as it's part of the system of care effort to help our young people and families. My name is Tammy Holland. I guess I should introduce myself. My name is Tammy Holland, and I work for the Institute for Excellence in Mental Health at UT Austin in the School of Social Work. We are very happy to collaborate with HHSC with System of Care and host these training and collaboration meetings with the System of Care community. So thank you for being part of today's meeting. All right, well, we'll go ahead and get started. We have a fantastic panel ready for you this morning. You're going to be really impressed with these speakers and their background. We've got two speakers who will be taking the first part of the meeting, and then two others who will take up the last part of the meeting. So beginning is Mr. Philander Moore. Philander, can you give us a wave so we know which one you are? There we go. So Philander Moore is recently retired from the Health and Human Services Commission, where he worked for 27 years. But he has over 40 years of experience in substance use disorder and community development. He served as the unit manager for the substance use disorder at Health and Human Services, and he orchestrated the implementation and development of the Texas Recovery Initiative. And he also orchestrated the first recovery-oriented system of care in Texas by using an integrated behavioral health approach through collaboration with funded SUD providers and local mental health centers. He was the statewide opioid coordinator for HHSC and serves on the advisory board and the national board of director for Faces and Voices of Recovery. And with Philander, we have Danielle Hodgson. I'm sorry, I've messed that up, haven't I, Danielle? Hodgson. Is that correct?
Yes, that's correct.
Okay, give us a wave, Danielle. She serves as a statewide opioid project evaluator within the Office of Mental Health Coordination at Texas HHSC. And in this role, she's responsible for developing comprehensive evaluation plans. She oversees program data collection, analysis, and quality improvement, and she engages with stakeholders to provide reports and updates about evaluation results. Her goal is to ensure that data can be communicated in a way that's approachable so that the results can be used to make data-driven decisions for the program she works with. So we will start with Philander and Danielle this morning. I hope you guys will tune in and be prepared to ask questions. And they will have about 40 minutes to present. So Philander, Danielle, take it away.
Okay, can you hear me? All right, and can you see the screen? All right, awesome. So Philander and I are going to be talking about how Texas is addressing the opioid crisis through the Texas Targeted Opioid Response. So I'm going to kick it off, and then I'll pass it over to Philander in a minute. So we're going to go over a few opioid basics, surveillance data. Philander's going to talk about his role in statewide opioid coordination. And then we'll talk about the Texas Targeted Opioid Response and several of the programs that we facilitate through that funding. So first off, many of you may know this already, but just to make sure we're all on the same page, opioids are a type of medication usually used for pain relief. There's a couple different types that we will talk about. So prescription opioids, those are ones you can obtain from a doctor. It's a way you can safely manage pain. Common brands include Vicodin, Ultram, OxyContin, Percocet, and things like that. Then we have synthetic opioids, which includes fentanyl. Synthetic opioids are up to 50 times stronger than heroin, so they're very, very potent. Prescription fentanyl is actually available and is safe when taken as prescribed by a doctor, but illegally manufactured fentanyl is a major contributor to overdose deaths in Texas. And then heroin is also an opioid, and this is an illegal and highly addictive opioid. And now I'm going to share a video about the fentanyl crisis.
Fentanyl overdoses are happening to people like you and the people you care about right here in Texas. Fentanyl is an opioid up to 50 times stronger than heroin. Illegally manufactured fentanyl is being added to counterfeit pills that look just like real prescription medications. It's also being mixed with other illegal substances. Fentanyl is nearly impossible to detect on your own because you can't see, taste, or smell it. Even the smallest amount, equivalent to a few grains of sand, can be deadly. That means any pill could be the one that causes fentanyl poisoning. Here's how to keep yourself and your loved ones safe. Whether you want to inform your child of the risks or are worried about a loved one who uses substances, it's time to talk about fentanyl. Only take prescribed pills that come directly from your doctor or pharmacy. Carry naloxone, a nasal spray that reverses fentanyl overdose. Naloxone is available without a prescription at many Texas pharmacies. Learn more about fentanyl, how to recognize an overdose, and how you can save a life with naloxone at txopioidresponse.org.
All right. So some of our surveillance data that we're able to share here. This is a chart with opioid overdose deaths. So opioid-related overdose deaths increased 56% from the 12-month period ending December 2019 to the 12-month period ending in March 2022. There is some updated data being released by DSHS, but unfortunately I don't have it on this slide. But what I wanted to point out is that for a long time, opioids have pretty much represented about half of all substance-related overdose deaths in Texas. And then I've got the kind of vertical gold line on the chart there. on March of 2020. I'm sure you know, that is when the COVID pandemic came to Texas. But when we look at this data, we actually started to see an increase in overdose deaths a little bit before the pandemic. But the pandemic really exacerbated the overdose crisis here in Texas, as well as fentanyl and synthetic opioids coming on the scene. So here's another chart. This is 1999 through 2021. So this also shows that, that top line is all substance-related overdose deaths. So it has been, steadily increasing since, since it's kind of, been tracked. And opioids have always kind of been at the top of that. So that's going to be most of the overdose deaths. Stimulants are another substance that is kind of coming up a lot more and more. You can see the yellow line just in the few recent years. It has, taken over and is getting closer and closer to opioids. So those stimulants are things like Xanax, methamphetamines, things like that. And this is a chart of accidental overdose deaths in Texas by opioid type. And so the, really dramatic thing seen here is that synthetic opioids in 2020 really jumped up. And now, they are involved in most opioid-related overdose deaths. I can't see my notes. So there's recently released preliminary data from DSHS showing that fentanyl poisonings were involved in 44% of all substance-related poisoning deaths in 2022. This is also an issue that is increasingly affecting youth and young adults. In 2022, 17% of all deaths occurred in people ages 15 to 24. So this is, a relatively new trend. Before 2020, youth were not the ones who were most likely to die from opioid-related overdose deaths. But with the, advent of fentanyl, especially those being mixed into the counterfeit pills that the videos talked about, it's becoming increasingly easy for this to get into the hands of youth and young adults. So one of the resources that we work with DSHS to provide is substance-related data on the Texas Health Data website. So they have information about the prevalence and impact of opioids in Texas. So there's dashboards available for drug-related deaths, alcohol and drug surveys, including the Texas School Survey, which is high schoolers, and the Texas College Survey, which is young adults. There's also emergency department visits, poison center calls, prescription monitoring program data. A lot of this data, where possible, is provided also at the county level. So if you wanted to look this up in your specific community, they provide a lot of data for that. And there also is a dashboard available that pulls data together for the public health regions. So for some of the counties that have smaller counts of deaths, sometimes those numbers have to be suppressed to protect the privacy of people. So those smaller counties, you may not always have data available. And so those public health region dashboards will give you a little bit of a smaller region than just the whole state of Texas to be able to see a little bit more local to just your area in Texas. And now I'm going to turn it over to Philander.
Okay, thank you, Danielle. Good morning again. As Tammy mentioned earlier, my name is Philander, and I'm the statewide opioid coordinator currently for HHSC. Just a little bit further about the experience that I have in working in substance use and how we've addressed the whole issue around opioids and fentanyl. For 27 years, as she mentioned, I have worked with statewide providers, funding providers across the state in developing not only programs related to the issue of opioids and SUD, but also around recovery. One of the things that I think has been significant, I was really excited about the idea of coming back to work after being retired for a few years, to work as a statewide opioid coordinator. The grant that was renewed during that time, the TTOR grant that we currently work under, required states to hire a statewide opioid coordinator. So currently, there's about roughly 38 statewide opioid coordinators across the nation. And they work in similar fashion that I do, and which is around the whole idea of addressing the opioid crisis through providers that are receiving federal funds from receiving funds from other federal agencies, not just the one that SAMHSA, which is the Substance Use Mental Health, SAMHSA, the federal agency that funds TTOR. So we, in addition to the funding that providers might receive to address the opioid crisis, there are a lot of federal agencies that are providing opioid funding to address the crisis in states. And one of the primary responsibilities that I have, and the other statewide opioid coordinators across the nation have, is to determine who those agencies are and try to work with them and coordinate with them to ensure that the state and that the federal agencies that are funding them are not duplicating efforts when it comes to addressing the crisis in those states. So one of the things that we were able to do back early on when I took this position was to develop a network of statewide opioid coordinators across the state. And while we all do some things different, we also do a lot of things that are similar. So as I mentioned, one of the things that we do here in Texas, I'm sure some of you may be familiar with, is the opioid settlement funds that the state is currently getting through lawsuits that they filed with a lot of the opioid manufacturers, the opioid people who are companies that are providing opioids. So the state is receiving a large amount of money over the next 18 years, huge amount of money to address this crisis in our state. So one of the things other things that I do is coordinate with the Statewide Opioid Abatement Council on how some of those funds are being distributed across the state. So we developed a relationship. HHSC has developed that relationship with the Comptroller's office to make sure that we're a part of how those funds are actually being utilized. And as I mentioned before, we're tracking funds that are coming to the state. One of the things that I've been doing to address that issue is to make sure that I created a network of providers who are only receiving those dollars, which I call the Texas Opioid Provider Network. We partner with them, not just them, but also some private agencies that are receiving it to develop different things like evaluate the efficacy of opioid services and initiatives, resolve problems, and identify improvements across the state. So that's what we see as a really important part, because it helps us in making sure and identifying we're not doing similar projects that they receive dollars from TTOR for and that they receive from the federal government. I said earlier that I developed the National Opioid Provider Coordinator Network. And one of the things that network does, we have a quarterly meeting where we address and talk about things that are going on in our state to address the crisis. Sometimes we share information to the point where we might be able to utilize some of the things that they're doing, and they may utilize some of the things that we're doing in our state as well. So going forward, one of the things that we've done, and I think you'll see more of that probably as you go forward. I mentioned the Opioid Abatement Council. There's a quarterly meeting that the Opioid Abatement Council had that's open to the public to be able to see how the state is addressing those issues and how they're utilizing those funds. I personally want to see some of the providers that are receiving those dollars from other federal agencies, because those dollars are drying up. So what we want to be able to do is make sure some of those providers in Texas are actually accessing some of those funds coming through the Opioid Abatement Council. Right now, I think it's going to be a RFP going out here pretty soon. If it's not already posted, I think it's going to be posted soon. To basically, the first thing they're going to do with those funds is address the whole idea around distributing naloxone across the state. So I can share more about that if anybody's interested in seeing how that's working. I can share that later as well. Can you jump to the next slide, please? Yeah, can't see that one. Okay, thank you. So one of the other important things that we're doing right now that I've done so far is for the last couple of years, I created a statewide opioid national report card, statewide opioid, statewide and a national report card. So right now we're working on a draft for the national report card, and I'll talk a little bit about what that's going to look like in a second. But the statewide opioid report card is the one that you're looking at on the screen right here. That just kind of identifies, as I mentioned earlier, the Texas Opioid Provider Network, the providers that are receiving some funds, federal funds. It identifies kind of an overview of what those programs are doing. And it actually identifies the regions that they're located in, the types of programs that they have, their locations and stuff, and then the total amount of dollars that they've actually received over the time that they've been receiving those dollars to address the opioid crisis here. Down below, you see it says Texas size achievements. Those are just specific trainings, specific opioid services, trainings, and those types of things that those programs did over the course of FY23. Of course, I'll be working on another report similar to this for FY24. Now, as far as the national report card, one of the things that we thought was important is that we, as a network, kind of provided some information about what states are actually doing and how they are addressing and implementing those statewide opioid abatement, the opioid abatement dollars across settlement funds across their states. So we agreed to create a national report card that will look similar to the one that you see here on the screen for the statewide. Well, it's going to have some slightly different information. It will probably share information about how much money each state is actually getting from the settlement, what those dollars specifically are going toward, time frame and the benefits that they expect to receive from those. So in that report card, we're going to actually identify some of the information. It'll talk about not just opioid, but specifics around fentanyl and those types of things as well. So we're looking forward to having that draft together pretty soon, and it'll be posted on our network just like this one is on the HHSC network website, just as this one is for our statewide. I think that's all I wanted to share here today. If you have any questions about any of this, feel free to, as always, just shoot us an email. That information will be provided at the end of the presentation. I'll turn it back over to Danielle. She has a little more information for you. Hopefully, at the end we can answer any questions that you might have.
Thanks. Okay. So similar to the report card that Philander just shared, we also create a TTOR program report card. And so this is a, quick, just front and back handout. It's available on the HHS website. It gives a brief program overview, the number of our programs, how many contracts we have, and the funding that we receive from SAMHSA under the State Opioid Response Grant, which is our main source of funding. We also provide services using the SAMHSA block grant, and recently there were also some funds awarded for COVID response, and so some of that came to our programs as well. So some of the Texas-sized achievements, as we like to call them, outcomes that you'll see here is the number of lives saved that is attributed to our programs. So all of our programs report when naloxone is used, to reverse an overdose. And so we keep track of that. We also keep track of how much naloxone we're distributing through our funds, how many people are receiving recovery support, medications for opioid use disorder treatment, and things like that. We also have on there a list of all of our funded projects. If you use the QR code at the bottom there, that will take you to our TTOR dashboard, which also has a lot of this information and more details, as well as links out to the websites of each of these programs, if you're interested in learning more. But we've got on here our Texas Targeted Opioid Response Continuum of Services. So TTOR provides prevention, integrated treatment, and recovery services. So prevention is data surveillance. So that's like some of the data that I shared at the beginning. Workforce training and development, which I'm going to give some more details about. Opioid misuse prevention, and then naloxone distribution. Our integrated programs kind of cover a variety of those prevention, treatment, and recovery services, typically in more non-traditional settings that aren't like a substance use treatment program. So interventions in traditional healthcare, like family planning clinics, community care coordination. So that's, getting people out into the community. And then opioid use disorder care in criminal justice systems. Then our treatment program consists of the medications for opioid use disorder. So that's the evidence-based treatment. And then contingency management, which is evidence-based treatment for stimulant use disorder, which we provide for people who have both a opioid use and stimulant use disorder. And then we have our recovery support services, which includes recovery housing. So I talked about the sort of workforce training program. So one of those is the Texas Opioid Training Initiative. And it's also called TXAUDI is the kind of short name. But here's just kind of a screen cap of their website. So they provide free continuing education for a wide variety of health professionals. So if you need CEUs and you want to learn more about opioids and how to work with people who use opioids, this is a really great resource. There's CEUs for physicians, nurses, social workers, they've got a whole broad availability for that. So some of the things they're talking about, outpatient setting, reducing stigma around opioid use disorder. The prescription monitoring program is part of it. How can you discuss concerns about drug use with your patients if you work in a healthcare setting and things like that. We also have a opioid misuse public awareness campaign. So this is facilitated by University of Texas Center for Health Communications. They do a really great job. So you may see some of these ads around on your computer or on YouTube, but there's information about the opioid crisis, and it links out to txopioidresponse.org, where you can learn more. There's a lot of resources there. There's educational content and videos, social media guides, conversation guides, PowerPoints, and treatment and recovery resources. So if you work at a local agency, there's a lot of content that's already made that you can leverage and use to share with the people you serve. And I'm going to show one of those videos. So the conversation guides is one of the newer resources that has been released, and those conversation guides are about how to talk to people who you think might be misusing opioids. We've got a couple of different formats for conversations that kind of help you think through how to have that conversation based on the relationship you have with that person. So whether it's a friend, family member, and the video I'm going to show is how to talk to like a parent talking to their child.
After recovering from an injury, I never thought my leftover pain medication could contribute to my son's addiction. It turns out he had taken opioids at a party, liked the way they made him feel, and turned to my medicine cabinet for more. Some early signs of opioid addiction are medications going missing, taking more than a doctor prescribed, or needing early refills, and taking or buying pills from other people. For my son, I started to notice that his behavior was just different. I was afraid he'd be upset with me, but I knew I needed to talk to him before something bad happened. I chose a time when I thought he was sober and asked if we could talk about something important. I tried not to get upset and spoke from my own perspective, sticking to I statements, like, "I've noticed you aren't yourself when you take opioids, and I'm worried about you." I wanted my son to see how those pills got in the way of the things he cares about. So I talked about how he'd been missing work and stopped coming to our family dinner on Sunday nights. He got pretty defensive, but I didn't take it personally. I was not going to give up. I reminded him that as his mom, I will always love him. A few days later, I brought up a family friend who struggled with addiction and is now in recovery. By talking about a friend, we could talk about my son's behavior without him feeling attacked. It took several conversations, but eventually he opened up to me about what was going on. I did my best to listen more than I talked, without criticizing or interrupting. So, we made a plan together to get help. We set up an appointment with his doctor, who referred him to treatment and prescribed naloxone, the overdose reversing drug to keep in the house. Talking about addiction is hard, but don't worry about saying everything perfectly. Life-saving conversations start with a few words. To get help, visit txopioidresponse.org. Just talk, Texas.
So one of the things that video talked about was the danger in having unused medications on the shelf. And so to kind of help prevent that kind of diversion of medications being used by people they're not prescribed to, we fund a safe drug disposal program. You may see drop boxes in places like pharmacies, but there are also methods that you can use to dispose of those drugs yourself at home. So there's two different products. One of them is like kind of a pouch. You can put the medications in there, and when you add water, it kind of like mixes together and deactivates it, so those can no longer be taken, and then you can just throw them in the trash. And then there's also envelopes where you can put your medications in there and mail them off, and they'll be incinerated. For people who are misusing prescription pain medication, over half of those people obtained that medication from a friend or family member, not necessarily someone that a medication that was prescribed to them. So proper storage and disposal of prescription medications is really important to limit the improper usage of them. So as a part of this safe drug disposal, there's also a school-based component to this. School nurses often have medications that get dropped off for kids while they're in school. And then at the end of the year, those medications aren't being used. They need a way to dispose of those medications. And so we have a school nurse-based program where you can request kind of a larger disposal takeaway envelope to dispose of those. So if you work with schools, you can refer them into this program. So then our overdose prevention, education, and naloxone part of our program is providing naloxone, which is the medication that can reverse an overdose. We fund a training program for that. So if you want to learn how to use naloxone and obtain naloxone for yourself or for someone else, you can visit that website. There's also information on a standing order that allows anyone to obtain naloxone without a prescription. But the great news is naloxone is also now over the counter. So you should be seeing it on the shelves at your pharmacies. Sometimes they're out on the shelves, like near the kind of like Tylenol and ibuprofen. Other times they might be behind the pharmacy counter or window, but you don't need a prescription to purchase them. And we also have More Narcan Please is our website where you can currently go and request free naloxone to be shipped and delivered to you. So the next topic is opioid use disorder treatment. So people with OUD who receive medications as a part of their treatment are 75% less likely to die from any substance use disorders than those not receiving medications. So a medication for opioid use disorder that includes methadone, buprenorphine, and naltrexone. Those are the 3 FDA-approved medications. And by taking one of those as a long-term treatment plan, it reduces the risk of overdose and death, reduces relapse, withdrawal symptoms, cravings. It's been shown to decrease criminal justice involvement as well as transmission of other infectious diseases. So this is the evidence-based treatment that is recommended. We fund this treatment for people who qualify financially. If that is, they don't have insurance and don't have very high income, then they can come to one of our funded treatment providers and receive that at no cost to them, or maybe on a sliding scale, just depending on income. And then the last thing I wanted to show you, this is a kind of screenshot of our TTOR dashboard. So again, we've got the QR code if you want to scan that with your phone and visit it. Or you can go to the HHSC website and look for Texas Targeted Opioid Response, and there's also a link there. But we try and share data about all of our programs and how many people we're reaching and what sort of services are being provided. So we've got some data here over time for the number of lives that have been saved through our program, how many people entered treatment through their recovery coaches or through TTOR integrated programs, as well as looking at for the treatment system, all of the treatment that HHSC funds, looking at how many people are going into MOOD, the evidence-based treatment, compared to other treatments when they have an opioid use disorder diagnosed. And so you can see before TTOR started in 2016, less than a third of people were going into MOOD. And through our funding, education about this treatment option, expanding access to the treatment, we've been able to increase that to about 74% of people going into treatment instead of something like withdrawal management or other non-evidence-based treatment. So yeah. that was probably a lot of information, but hopefully we've shared a few resources too that you can go and look up if you want to get some more information. And our emails are also here on the screen if you want to reach out to us for more info.
Thank you, Danielle and Philander. We have a number of questions in chat. The first one I have a question is, does HHSC or TTOR provide any type of emergency response to cities like, say, San Marcos that have experienced unusually high numbers of opioid-related deaths?
Yes. So whenever we hear about any sort of spikes like that, so I think we've heard about San Marcos. I think Kyle's another one. There's some small cities outside of Houston. If we hear about that and we get connected with the right people, we can connect them with some of the resources we fund. So providing naloxone, safe disposal materials, some of the education and media campaign materials and things like that. We also have a program that is just getting off the ground called TextCope. And it is a platform for people to be able to report opioid overdoses that have happened in their community. And one of the things that we're trying to do with that as it gets, more utilized by communities is to be able to figure out a way to track some of those spikes and see if we can, detect when there's, spikes in a community, so we can kind of make sure that resources are going to the, local providers in that area.
And then another question is, do all the cities receive the same percentage of funding that you mentioned? And can new cities apply for some of the funding?
Was
I'm not sure which funding that's
Yeah.
in reference to, if that's TTOR funding or maybe the Abatement Council.
Yeah, which one were you asking about?
I'm not sure. Ceci, you asked this question. Could you clarify? Was that, or was it just a general question about any funding?
No, it's because sometimes, on our city, on our community, we really don't have funds, okay, to get some information, and we got some clients that they need some help, but unfortunately, sometimes we don't have the funds, and we ask and we try to Google it, and we try to find out where we can have an answer. And also, unfortunately, over here, like on Canotillo, the internet doesn't work real good. So we need a phone numbers. And on this one, I need to make a remarkable, I don't know if you can say suggestion, please. You guys have more the power to go ahead and get an intervention for us. Then we need a phone numbers. Just remember, some of these communities, they not technology, they traditional. They come across the border from Mexico. They need phone numbers, not links. I'm sorry for saying this. And sometimes they don't have participation, probably, on the political meetings, because they're not even been informed that they can be present on those, that they can have a participation. We need to educate them, but how we're gonna educate them if we don't have the right information that we can give it to them? They can be more accessible to them, okay? It's
Okay.
just that. That's the reason, I'm worried about it because I care for my community. And if there's some funds, we need to spread the voice. Then we have the funds that we can do something, then we can go ahead and find out the information on this and this place, okay? Thank you, I'm so sorry. I talked too
That's
much.
So, so let me respond, Danielle. You can talk about the TTOR access by way of that, because I know that in order to access TTOR funds, it's basically around the grant periods that we have through the RFP. So that's one way. But with the opioid abatement council funding, there's a couple of different opportunities that will be existing here pretty soon. One is through the hospital districts, the other is through the counties that have already received settlement dollars. So some of the programs that I have been working with through the Texas Opioid Provider Network are in different areas of the state. Now, I don't know, Cecilia, I'm not sure where you're from, what city you're in.
That's El Paso, Texas, but
you're in
it's
you're not-
on Canutillo area.
Okay, so you're in El Paso. So, okay. So there is some contacts, and then there is some information I can share with you about how the funding through the Opioid Abatement Council is going to work. And one of the things that we have to provide a network's trying to do is try to connect with the counties and some of the hospital districts so that they may be willing to put some of those funds that they've already received out into the communities. So I can talk with you about that, and I'll give you my number, and I can share it a little bit. It'll be a little more better. It'd be better if you and I just talk one-on-one, and I shared it with you that way. That way it'd be easier for you to access it.
Thank you, sir.
Yeah, no problem.
And I believe the two of you may have already mentioned where you can get the deactivation pouches, but could you just repeat that information, please?
Yes, so I don't know if I actually had the link in this presentation, but if you go to the dashboard, you'll be able to see our program overviews, and it'll have a link to the page. The program that provides it is University of Houston in the Premier Center. So also if you Google that and Google safe disposal pouches, that should probably get you to the website. But once we're done with the questions, I can go get the link and put it in the chat too.
And I'm hoping that you'll share your slide deck with us so that we
Oh,
can distribute that afterwards.
Of course.
Okay, thank you. I think the deactivation pouches would be a great resource for local mental health authorities and other organizations to just provide at their centers.
Yeah.
And I think you also mentioned the resource for the free naloxone, but could you repeat that as well, please?
Yes. So that is More Narcan, Please, is the name of the website.
Narcan, please.
morenarcanplease.com. So you can visit that website. There's a order form. You can either order like individual kits just for yourself and your family members, and there's also an order form for organizations to get a larger box of kits shipped to you guys, and that way you can distribute it to the people that you serve. And then, once you've distributed that, you can always go back and get an additional set of kits.
Awesome. Before we move on to our next two speakers, does anyone else have a question for Danielle or Philander? Don't make it too easy on them, guys. I know it's the day after Valentine's Day, but they can handle your questions. All right. Well, I guess that's it. If you do have a question or you think of something as we go along, just add it to the chat box. Thank you, Danielle. Thank you, Philander, for the information. We certainly appreciate it. And we will move on to our next two speakers then. Thank you so much. Okay, so our next two speakers, the first is Anne Hettenhaus. Anne, can you give us a wave? There you go. Okay, Anne has more than 18 years of service in primary and post-secondary educational settings. She is the education specialist at Region 13, and she coordinates the statewide training in the PAXIS Good Behavior Game. She previously identified support services for students and families with complex needs at Round Rock ISD, and she managed the opening of a post-secondary program for adults with disabilities at UT Austin. And she's also presented to a wide variety of audiences, including students, parents, and community members in Texas. And Anne is joined by Jeanette Puskas. Jeanette.
There you go. Good. Yes.
Jeanette. Yes. Okay. Thank you for giving me another chance at that. Jeanette serves as a PAXIS program manager providing guidance and support to organizations as they plan for PAX programming. And she has a background in organizational leadership. Jeanette has spent over a decade providing support to our national and international sites in implementing, expanding, and sustaining PAX throughout their school and community. And she's also an international PAX trainer and works closely with different sites in strategic planning for large-scale implementation. So Mary Ann and Jeanette, you have the floor now.
Thank you so much. Again, my name's Mary Ann. I'm with the Education Service Center here in Austin, Texas. The reason why we're here is to talk to you about some preventative programs that Jeanette and our team have worked with in coordination with HHSC's Texas Targeted Opioid Response. So this is important. This training that we're going to be talking to you about is grant funded, which means free. So I'm going to turn the mic over to Jeanette, but I'm hoping your ears have perked up because we are here to talk to you about ways that you can help children and youth in our areas to help prevent some opioid issues. So Jeanette, go ahead.
All right. Thanks, Mary Ann. Thank you, everyone, for having me today. That was a great introduction. I really appreciate it. I've been around the PAX world for, gosh, a long time. And really what we're talking about today is not only how do we get into the spaces to support our kids and our families with prevention. So what do we do to really get upstream when our kids are young and to support our families with some really great strategies, but also what do we do to help our professionals who are working with our families and kiddos? So we're going to talk a little bit about that today, really thinking about how do we create a shared approach to behavior, a unified approach to prevention in our communities. And as Mary Ann said, we're going to share information around how do you get this and bring this to your community for free, fully funded across the entire state of Texas. And as always, as we mentioned in the introduction, we're also here to help talk about how do we sustain this? So it's not just something that comes in for a year and it's gone. How do we create a program and really meet the needs of what's going on in your community, because so that this becomes part of the way that we operate. And so I'm going to share a PowerPoint, but please, put your questions in that chat box. Happy to address those as we go along or at the end. And we hope that you really gain some information around how do you bring this to your community to support those that you serve as well. So I have a PowerPoint here. We're going to do an overview and I am going to get started. So let's talk about PAX and PAX specifically in the state of Texas. And so as Mary Ann mentioned, we have some opiate response dollars to provide these trainings and support to you and your community at no cost. So I'm going to really talk about the background and what the trainings look like. So let's first talk about what is PAX and PAXIS Institute. You heard me mention that we are a prevention science company. So how do we get upstream a little bit? How do we provide some prevention in your community before it becomes a problem? So we know that we need to really use some strategies to address the situation when our kids are young, and again, to provide this to our families and communities. So we're a prevention science company that incorporates cultural wisdom into tested and proven strategies. We talk about this all the time. What does it mean to be research-based and trauma-informed? We're going to talk a little bit more about that, but how do we provide you with practical strategies to do this, to operationalize your trauma-informed practices? So we're going to give that to really implement meaningful interventions that improve not just short outcomes and short data and things that we're going to see, but also those lifetime outcomes for our young people and the adults who care for them. So we're going to talk about that. PAXIS Institute, we are the official purveyor of both the PAX Good Behavior Game, which is our school-based program, and our community-based program, which is called PAX Tools. So we're going to talk about both of those today because all of it is included in these no-cost trainings. Let's first start to talk about, imagine what your community looks like. Think about what it would be if we could provide behavioral strategies across the system of care. So everyone that comes in contact with a young person in their professional and personal lives. So wherever a kiddo is learning behavior skills, PAX has an appropriate application. We're going to talk about what that looks like for equipping our educators in our schools with some strategies. What about our before and after school care staff? How about our boys and girls clubs, behavioral health, community-wide prevention, really thinking about what this might look like in our residential treatment centers or our Department of Children's Services. So again, everywhere that a young person goes, we have an appropriate application for how we can address and teach behavior as a skill set. And so PAX is going to be able to do that. You can see all of the things in our community and where we have an appropriate application for PAX. We're going to dive right into those. The first question we always get about PAX, what is PAX? What does that mean? So PAX is not an acronym for anything. It's not a program or curricula. We don't get our PAX manual off the shelf at 2 o'clock and read a lesson or a story. What we're really talking about is providing practical, evidence-based, trauma-informed behavioral strategies in the hands of professionals to make an impact right away. So PAX is Latin for peace. And when we talk about that, what we're talking about is how do we create peace to really look at reducing stress and anxiety, including workplace stress. So we have our outcomes that we're going to talk about that do just that. How do we increase productivity for our kiddos in our classrooms and those settings that they're in to increase their regulation, their self-regulation, their stamina for focus and performance on tasks? How do we improve our health? That includes reducing substance misuse, improving our health and mental health and lifetime outcomes. We have data that shows that. And how do we improve our happiness to promote positive relationships and cooperation, not just with our kids, but also for the adults? So our kid to young person relationships and our adults within our workplace environments. The foundation of PAX, this is what we really hang our hat on. When we talk about PAX and we implement those strategies, we're going to use a trauma-informed approach. We're going to come in there and do no harm. Again, we often talk about why using a trauma-informed approach is really effective and appropriate. But how do we do that? How do we operationalize and give you the recipe to do those things right away in your settings? So that's what PAX does. We're going to teach behavior as a skill set, just like we teach how to ride a bike and tie our shoes. We use effective strategies, but sometimes we don't do that with behavior. We get reactive to behavior. We escalate. We don't know how to address the lagging skills of behavior. So PAX is going to give you those strategies and those ways to do that. We're going to create a nurturing environment that not only helps our kids thrive and survive their environments, but move into an area where they can thrive in those environments. They can learn those behavioral skills in a setting and then take them into their community and their home environments. And we're going to really be able to create what's really important here, reliable and consistent adults. We're going to get on the same page about our behavior, about our expectations, again, to create a unified approach. Let's first talk about what is PAX Tools. So PAX Tools is our community-based programming or trainings. That's anyone that works with a kiddo or even a family member outside of that school-based setting. So let's first talk about that. PAX Tools is we're going to use a set of strategies that really utilize some evidence-based kernels. Those are those smallest things that I can do that are going to bring some behavior change. When professionals come to training, we give you a menu of strategies to really add to their toolbox of what they can do to improve cooperation and relationships among children and adults. We're going to give you those strategies to really richly reinforce the good stuff. How do we get more of that? PAX Tools strategy, promote self-regulation. So we're going to go beyond just behavior management. How do I teach my kids to have some self-regulation skills, which we know is the lasting impact? That's what's going to really give us those lifetime outcomes. because we're going to reduce conflict. We're going to improve the overall climate that our kids and our adults are navigating in. And we're going to decrease the risk for mental, emotional, and behavior disorders. So when we address those self-regulation skills, we're going to give them that lifetime impact that they can take with across all settings. All of the strategies that we talk about and learn are trauma-informed, evidence-based, and culturally responsive. Because again, we're not writing a lesson plan. I always say you don't want a 50-year-old woman from Ohio writing a lesson plan for your kids in Texas. So that's why we just teach you these behavior strategies, because you know best. We're going to equip our professionals who then go and work directly with their young people to implement the strategies that are going to be appropriate across all cultures and for all ages. Now, who can implement PAX tool strategies? You heard me talk a little bit about appropriate application across multiple settings. And so that includes our parents and caregivers, foster parents, kinship care providers, out of school time staff. So think about those young youth development workers who might be 18 or 19 years old. Imagine what that would be like if we gave them practical strategies to teach behavior and address behavior in their settings. Childcare providers, counselors and clinicians, faith-based staff, volunteers, and again, those youth workers. So again, everyone within the life of a young person having these unified approach to behavior. What are the trainings that we're offering through this initiative? So this is just an overview of what that might look like. We have 4 different trainings that I want to highlight here. PAX Tools for Human Services. That's really for our full-time staff that work directly with young people. We're going to put you through a full day, 6 hours of content training where you're going to learn. Again, we're going to do a level set about behavior, about talking about trauma-informed approach, but then really give you those practical strategies to use in your professional setting. Then we're going to talk about PAX Tools for Community Educators. These would be our professionals that work directly with families and caregivers. We're going to equip them with strategies so they can then go ahead and give some workshops to families. How do I teach our families these strategies as I work with them in my professional setting? We have PAX Tools for Youth Workers. This is our, really think about our part-time staff, maybe a Boys and Girls Club, after school care staff members that might be seasonal or part-time, that really have that entry level into working with kiddos. We're going to give them these similar strategies that they can use right away. And then our caregivers. These is really ideal for kinship care providers, adoptive parents, foster care parents, that we're going to be able to, again, equip them with strategies so they can improve relationships and really be able to address behavior as a skill. Here are some outcomes that we are seeing when we're implementing and training our professionals. You can see some of these outcomes and benefits, and right here at the top, Texas statewide implementation, directly right in your backyard in the state of Texas. But when we train our professionals in PAX Tools, 99% of them leave training feeling ready to implement right away. So tomorrow they're going to have these strategies. We have statewide implementation in Ohio, where we're also reporting 97% found that PAX Tools work with the children that they support. And then 95% of our professionals find that PAX Tools really help to increase their own confidence in working directly with kids. And so these are from our Boys and Girls Clubs as well. And we see here on the left that we're also seeing where our workers are feeling that their supervisor is noticing some changes in their ability to impact in the work that they're doing as well in supporting kids. And we're also seeing a reduction in symptoms of depression in the kids that we work with as well. So immediate impacts. And this is just within the first 8 to 12 weeks of implementation. Now I'm going to highlight a little bit. I talked a bit about our PAX Tools, our community-based side of things, but let's dig in because we also have our school-based side. We know that our kids spend a lot of time in schools, and we want to equip our educators with some strategies, again, in their toolbox that they can impact the environment that their kiddos are really trying to navigate when they come to schools. We know our educators have been really stressed out and we have a high turnover rate in our educators. So what can we do to address that? we're going to equip them what's called our PAX Good Behavior Game training. We're going to utilize similar strategies, those evidence-based kernels that they implement during regular teaching time. So whether I am doing reading or transitions in my classroom, morning work or group work, I'm going to utilize strategies that is not something extra I need to do, but it's while I'm teaching everyday classroom assignments. I'm going to have some strategies that are going to help to improve self-regulation skills, increase positive behavior, and really teach that positive behavior as a skill set. Our teachers implement those strategies through regular classroom procedures. It's not something extra. But when we do those, we're going to see some increased academic performance because our kids are going to be able to have a little bit more focused stamina time. We're going to increase that intentional time for learning. We're going to have improved behavioral outcomes. So we're going to see the good stuff get better because we're also going to then see some improved lifetime outcomes. So not only does the good stuff get better, but we're also going to start to see a decrease in unwanted behaviors as well. So the PAX Good Behavior Game increases the regulation in pro-social behavior. We're going to decrease problematic behavior. I'm going to teach my teachers also, how do I address behavior ahead of time as prevention instead of being reactive to behavior and reacting when things start to escalate. We're going to really work with our teachers to be able to recognize when the good stuff is happening as well. But when we do that, we're going to give our teachers also about 1 additional hour of learning time because we're going to shrink down those transitions. We're going to improve that focus time and our stamina for learning. We're going to have approximately a 75% reduction in problematic behaviors, significant increase in standardized test scores, and really important on the front of a lot of folks' minds is significant reduction in our teacher stress and burnout because we're going to give them strategies that they can use right away. So what does all this look like? This is a video directly right here from the state of Texas. So we want to share with you what your educators are saying about PAX in their classrooms and in their community as well. So I am going to share this video with you.
All right, you guys, listen.
Boys and girls, we are going to get our day started. Are you ready?
PAX means peas, which is one of my favorite words. It's not a set of lessons or a curriculum, but rather it's a prevention intervention that's used by educators in the classroom. It's a set of 11 evidence-based strategies that's used to build children's self-regulation skills.
I want you to use your 3-inch voice. Good job with that, PAX fingers, Jackson. Please make sure we are still PAX leaders. So the PAX Good Behavior Game was kind of like a godsend to me. I was out of tools, out of ideas. I knew there had to be a better way.
The PAX Good Behavior Game has made a difference on our campus.
It's actually been able to give me, as a first-year teacher, classroom management. They are able to stop what they're doing, hear the directions. They stay calm.
That's very easy to implement. You don't have to put a lot of money or time into it. What I really like about PAX is, first of all, we're providing a very clear and systematic training of how to utilize it in the school environment, in the classroom environment.
It's in one package. It's very simple to use.
The first thing you do with PAX is you create a vision. And that's the beauty of it, that you create it together along with the kids.
They make the rules, they build their culture, and they stick to it.
PAX works because you are focused on the positive.
It looks like, okay, we're going to do a little bit of work, then we're going to have some fun, and then we go right back to work, and then we have some fun again.
I love that I'm able to create a culture that is supportive of kids learning, that is supportive of their development and supportive of just the whole child.
An action that would be a negative action is called a spleen. And it's a funny word. And the whole point of it is just to, hey, you need to reset. My favorite thing that we do are the toodles. And they'll write toodles for students for being a good friend, for participating well in class, completing their work.
We were able to kind of, use PAX to help them turn all these routines into a game. And so it was something that was fun for them. It gave me a little bit of peace and sanity that helped so much, which is why I'm still using it.
I think it allows the child to grow. It allows the child to self-regulate and learn those
practices. It creates positive outcomes related to mental health, classroom behavior, and academics.
Our kids have a continuity that is not normal in each and every school system. And so it provides the guidance that our students need. It provides the guidance for staff.
I would really encourage people to go through the process. You will truly see a great outcome. You will see a school that is able to be managed by all stakeholders. You will have order, and with order, we know that kids are able to learn and they're able to grow.
We want them to love learning and have a sense of who they are as young students to carry out into the world. They want to do it because they see results.
PAX works. It really does.
So that was just really kind of an overview and a reflection from the school-based side of things. But as I mentioned earlier, we have that analog for the community-based side. So putting those same strategies in the hands of all of our professionals and our family members. And I heard words in that video like, we co-create these with our kids. Our kids are the ones who drive what it is that they want to see, what they want to do. And that's why it's appropriate for all ages and across all regions internationally, because the kids are the ones who are saying what it should look like. They're in the driver's seat. They're taking ownership of their own behavior, which then allows them to again create and let you know what they need in their environment to thrive. And so that's what we're teaching our professionals to do. We're co-creating those things. We're recognizing the good stuff, and we're creating routines that help our kids to be able to navigate in a safe way as well. And so really taking it from the lens of our educators and right there in the state of Texas who are seeing those impacts. So I want to highlight, like I did in the community-based side of things, what this looks like in our schools. So you see a big array of trainings. That top layer there talks about all of those initial trainings. So the educators come and they learn all of the basics. They learn a good foundation about behavior and then those practical strategies. We have trainings for anyone who might work in the early childhood setting, as well as for our adolescents. So thinking about our middle school and high school aged kiddos. And then we drop down a little bit and we offer what's called our suite of professional development. So what do we do after that initial training? We have trainings for recalibrating implementation, for creating PAX partners, which is that coaching and support, and then our PAX heroes, which is really to target and think about what do I do for kids who needs more additional behavior support there. So how do I talk about tier 2 and tier 3 strategies as well? So really, again, equipping our professionals with everything they need to sustain and make this the way that they do business in their classroom. What are some of those benefits? We're going to talk about immediate, mid-range, and long-term benefits of PAX. When we have those immediate benefits and we're implementing our strategies, we're going to see a decrease in problematic behavior, increase in that focus time, pro-social behavior, and teaching and learning time. So imagine what your educators are going to do with an extra hour of teaching time. Those immediate benefits give us some mid-range benefits. We're going to have improved reading scores, standardized test scores, really helping to decrease that teacher depression and workplace stress, and are reducing our school violence and suspension rates. And what we know is we have those long-term benefits as well with PAX. When we think about the PAX Good Behavior Game, we have longitudinal studies out of Johns Hopkins University looking at following these kids and the studies into their adulthood. So we're into our 40th year of studying those initial cohort of kids that received the Good Behavior Game. Way back in, and we see over 50 independent studies confirming just a wide range of benefits, which include increased high school graduation, reduced risk in mental, emotional, and behavior disorders, decrease in opiate and other drug misuse, and a decrease in suicide as well. So we see those lifetime outcomes as well. And this is looking at those long-term benefits from that research out of Johns Hopkins University. At any time, we always offer folks to visit I'll share that with you, our website, where you can really read all about some of those studies and those impacts that we have as well. And I really want to share some exciting outcomes and benefits right there in the state of Texas. So we've been doing these trainings for some time in the state of Texas and continue to offer these. And I know Mary Ann's going to share some of that information. But this is looking at specifically right there from some data from 2022 to 2023, right there in the state of Texas. So 100% showing that PAX is helpful for students who need some additional and that behavior support. And they're seeing an improvement in our standardized tests, our prep for our test scores for our kiddos in the state of Texas. And that for our PAX tool strategies, we're seeing that these are useful across numerous environments, really with our PAX tools youth workers, and that they left training feeling that they had a really clear plan for implementation. And we provide all of the resources once someone is trained with materials and an app and resources forever to our website that really helps people walk through how to implement this in their situations and in their environments. But this is that statewide, Texas really showing what that impact has looked like. We've made PAX Good Behavior Game training available to all teachers and educators since 2020, and we're continuing to do that. Over 3,200 educators have been trained in that PAX Good Behavior Game, and over 1,600 folks have been trained in our PAX Tools community-based programs. We've improved outcomes for your youth and your staff, improved educator wellness and reduce that workplace stress, and improve student behavioral and academic performance. And again, we've been doing this throughout the state of Texas since 2020. Again, the highlight of the trainings that are available in the community-based side of things, you see those 4, and the school-based side of things. And now I'm going to turn it over to Marianne, because she'd like to share with you, how do you get this specifically for your setting, or how do you gain more information? So we're going to talk a little bit about the different trainings that we offer. You saw that. We offer them in both virtual and in a self-paced option to really meet the needs of your professionals and your community. So we offer both of those modalities throughout with this initiative. So Marianne's going to highlight that for us a little bit.
Thanks, Jeanette. In the chat, I'm going to put some information. We have our own website where we house all of the information about the program and about all of the trainings that we offer. So you can either use the link that I've put in the chat, or you can Google Texas Good Behavior Game. And again, our partnership is with Health and Human Services TTOR grant. They are our partners that provide the funding for this. And then PAXIS is the one, or the PAX family, who actually does the training for us. Region 13 is the person who makes it happen. We have this website. When you get to our website, it's going to ask you, what are you interested in? Do you want the PAX Good Behavior Game? Do you want PAX Tools? And you can use those drop downs to go to the next slide, and it will show you the available dates. Now, you will notice on our website that we have both live virtual, and what that means is if you are signing up for a live virtual training, you are trained over Zoom, much like we're doing today. The classes are not gigantic. You're not in a class of 500. Typically, we cap them at about 30, depending on the situation. So you will not be in a huge room. It's not what we call in the South sit and get. It's actually very interactive. So that's our live virtual training. Our self-paced training is for someone who can't take a day for training, but can do it in short segments. And that allows you to take the training and you have about 2 weeks to complete it. And you take the training once you are, when you're available. So those you'll see on the screen right now, those are our school-based trainings, the Good Behavior Game. This is not actually a board game. This is a game where the teacher interacts with the students and sometimes will collect points or give good juju for a team, but it's not a board game. It's just a game that you have throughout the day to allow you to do some work and take a break. Our next slide is, again, the tiles that direct you to the trainings that we have for our tools, which we talked about. Human services, again, those counselors, caseworkers, wraparound support. That training is for you. Community educator is the training that if you are in charge of a program and you'd like to do some outreach to parents, families, or other community members, community educator is a great training. Our training is done in English, but if you are in a situation where you need to train in Spanish, the actual booklets that we provide you as part of the training do come in Spanish. So the information that the trainer gets is in English, but we do provide options for the attendees at the training in Spanish. And then our youth worker training is for those folks who are in an entry-level position, but working directly with students. Again, want to reiterate, our trainings are grant funded, so the training is free. Every training comes with a manual and materials. We send those to you free. And also there's some follow-up options that we have that are also free. So as you saw, I put into the chat the link for the Good Behavior Game website. That's where you get it. If you have general questions, you need to understand, well, I'm not really sure which training I should take. You are welcome to email our general email address, which is paxgbg@esc13.net. Or if you want to email me directly, I'm the person that works directly with all our folks in Houston, so that because Jeanette trains all around the world. So I'm the person that handles Texas here in Austin. If you have 20 or more staff members that you would like to train at one time, we can create a cohort for you so that you can pick the day and time that you take the training, and we coordinate the rest. But we do ask that you have at least 20 staff members. So anything that we can do to support you in getting this training to yourself or your team members or your school staff members, we are welcome to help. I'm trying to think, let me look here on the chat to see. Let's see.
One question that I put on there, and I feel kind of silly asking it, but is the Good Behavior Game an actual board game?
No, it is not. Jeanette, do you want to address that?
Sure, I can address that. Let's see. So the Good Behavior Game, PAX Good Behavior Game, and I can pull the website up again for you if you need to, is not a board game. What we do is this is specific to our classroom based implementation. And so really what it is teachers learn first all the strategies. So we're going to layer them with 11 practical strategies that they do during classroom procedures. Once the strategies are implemented, then we put them together, and that's what we call the Good Behavior Game, or the PAX Good Behavior Game. So typically what it looks like is, while I'm doing math worksheet, I tell the kids, okay, we're going to play the PAX Good Behavior Game. And during that, and the reason it's called a game is because we're going to set up expectations, think about like you would rules for a game. So we're going to say, okay, during this math worksheet, what should it look like and sound like? What are we going to do and not do? And so the students really set those behavior objectives or the goals. And so that's why it's kind of called a game, because with a game, we set up those objectives and rules. And so the students do that. And then the teacher says, okay, that sounds great. During our math worksheet for the next 5 minutes, I'm going to be looking to make sure that we're following our behavior objectives. And during that time, the teacher's scanning the room and looking through and saying, okay, I notice they're in teams, just like a game would be. And so team one, great job. I noticed we're working really hard with a 0-inch voice. We're just going through, and during that time, if we notice anything that might not be following the rules that the students just set, we give a verbal alert. And I say, something like team one, spleen, and that's a made up word, because again, the students identified what that is. And we just mark a point, and that means, okay, check yourself. That's kind of like my caution light. When we have a visual, when we're driving down the road and we see a caution light, it's like, uh-oh, check myself. So everyone on the team learns how to regulate their own behavior. So as opposed to a teacher coming up and saying, you know what, you need to fix it and do this to make it right. The kids, we want to gauge their ability to regulate, check themselves, and fix the behavior. And again, that's just a verbal way. And at the end of those 5 minutes or 10 minutes of time, we're going to then assess, did we meet our behavior objectives? Did we meet the goal? And then they're given a reward. I call it the positive consequence. We're going to celebrate. Okay, teams, we made our behavior objectives. We're going to celebrate. We're going to get to do something fun. Again, what the kids have identified is rewarding to them. And it can be anything from, you know, a 1 minute paper ball fight to you get to sit next to someone in class and change seats. So the kids also, not only do they set the behavior objectives, we set the time to meet the behavior objectives, but then they're given that positive consequence and celebration to say, we did a good job. And here's that, you know, the cause and effect, because we did this, then this is the effect that we get. And we're going to celebrate with something that's rewarding. And then we get right back to work. With that, when we do that, what we know is, as our kids are able to keep the behavior objectives, stay on task, then the teacher then says, okay, next time we were able to do that for 10 minutes. Now we're going to try for 12 minutes and then 15 minutes. And before you know it, the students are able to focus, learn for 45 to 50 minutes at a time. And that's a typical thing that we see in our classrooms. So that's why it's called the PAXIS behavior game, because we set it up like a game would, with, you know, setting objectives. Here are the rules. This is what we're going to do. And then we're going to work together as a team. And so I know that's a very general and overview.
No, that
but
makes perfect sense.
Yeah,
Thank
we
you
work
so
our
much.
teachers to that.
Well,
All
it is
right.
11.
I see it's I see
Yeah.
it's time. I just wanted to say, I'm the person that handles questions. I'm the person that handles all the things for Texas. So I put my information back up. If you have any questions or have issues getting on the website, just email me or that paxgbg@esc.net, and I'll help you out.
Thank you. Thank you, Philander. Thank you, Danielle, Marianne, and Jeanette, for your presentations today. I certainly appreciate all the information. It was invaluable. And everybody, please don't disconnect before you hit the link to go to sign in and let us know that you attended today. And then also let us know how beneficial this information was to you. Thank you, everybody. Have a great day. Have a great day. Bye-bye.
Bye-bye.